We could bring into order our District Board of Health meeting for Thursday, July 25th, 2024. And I'm looking for a quorum. Roll call.
Chair Christopher Dare.
Here.
Vice Chair Devin Reese. Oh, he is online and being admitted right now. Mary Luz Garcia.
Here.
Dr. Rika Dinko.
Here.
Michael Brown.
Here.
Dr. John Clacking.
Here.
Dr. John Novak.
Here.
Thank you. We do have a quorum.
If we
Here.
could, oh, hello, sir.
Hello, sir.
And so we do have a quorum. If we could stand with me for the Pledge of Allegiance, that'd be fantastic. And John, I'm so glad to have you here. You got to lead us, sir.
Always good to be here.
And that shirt is just screaming.
I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Play ball. Okay, we're looking for an approval of the agenda or any other conversation we'd like to have about the agenda.
Move to approve. This is Councilmember Reese.
Hey, I'm going to go with Devin Reese, nothing personal, but will you second that?
second that.
Thank you, I appreciate that. So we have a first and a second. Any more discussion? Hearing none, all in favor?
Aye.
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 That passes unanimously. We're going on to recognitions, number 4, and let it be known that our District Board of Health is off at NACHO having fun. He's listening, hanging out with us and all that good stuff. But Aaron Dixon's filling in, and we appreciate that.
All right, thank you so much. We have a number of recognitions today, but I'd really like to start with Charmaine Roquet. She is a promotion, but actually a new hire to CCHS. And if Ms. Lotritz wants to come down.
Welcome.
Welcome. Lisa Lotritz, Division Director for CCHS, and I'd like to introduce Charmaine. Charmaine has joined our immunization team as a public health nurse. She comes from Washoe County Juvenile Services. In that role, she engaged in health promotion, education, and health care for juveniles. She will undertake a similar role for NMPH, providing immunizations to the public. Prior to her time at Washoe County Juvenile Services, Charmaine received her bachelor's degree in nursing and also a bachelor's degree in psychology and sociology, both from the University of Nevada, Reno. So I'd like to welcome her.
Welcome. Yeah.
All right. So we'll move on to our years of service. Kayla Sorio. Let's see her. She's off doing good work. She has reached 5 years. Congratulations to her. Diana is with EHS. I don't see her. She is with our Permanent Facilities Program and off doing good work. She has reached 10 years. And then Virginia McDonald, I just spoke with her this morning. I know she's not going to make it down here, but she is with an office specialist with AHS. She was also very critical component of our COVID response, and she's currently with AHS and been here 10 years. So congratulations to them. Promotions, Susie Valdespin, you're all aware, has been promoted to the Public Defender's Office. A transfer into that position is Jackie Lawson, who you will all be introduced to next month. She is on leave this week. Retirements, Irene Ramos Hernandez. She was with our WIC office for over 29 years. The impact that she had on those WIC families, I'm not sure we could measure it with the number of families that she reached. So she will be greatly missed. Also on here is Kevin Dick. His official last day with the Health District was July 5th. So congratulations to him. We have a number of health heroes. This is always one of my favorite parts of the meeting, to honor those staff that have been nominated and honored. So Andrea Esp with our PHP program, she was honored for collaboration. Danica Williams, also with our epidemiology and public health preparedness, she was honored for adaptability, collaboration, and trustworthiness. Trying to see if those are here. All right. Wonderful. Welcome. We will get photos later. Kelsey Zaski, she also with epidemiology, public health preparedness, is being honored for her adaptability, trustworthiness, and collaboration. Jessica Connor with our community and clinical health services is being honored for her adaptability, trustworthiness, collaboration, inclusivity, and compassion. Heather Holmstadt, I thought I saw you. Yes, okay. With community and clinical health services is being honored for her adaptability, trustworthiness, collaboration, inclusivity, and compassion. Rachel Cord with Administrative Health Services, who I know is not here, is being honored for her collaboration. And then we have two large groups. So I'm just going to go through their names. Our immunization program, their clerical and billing staff, they are about to ramp up immensely for our back to school, but they have been honored for their adaptability, collaboration, and communication. And I'll just go through them quick. It's Kara and Andrea and Debbie and Olivia and Sahara and Brianna and Liliana and Bianca and Carla and Cynthia and Anna. So thank you very much to them. And then our final group, if you guys wouldn't sit so far away, I wouldn't have to get my glasses back on and off. The final group is our intermittent or hourly immunization RNs. So for those of you who aren't aware, our immunization program is run with a lot of support for what most clinics call per diems, and we wouldn't be able to run it without them. And they are being honored for adaptability and I think collaboration, and that is Judy and Kathy and Carolyn and Holly and Chris and Steve and Jan and Wendy and Janine and Alyssa and Peggy and Charlotte and Larissa, and I hope I got everyone. So if everyone who's here, if you could just kind of wave and so we can acknowledge you, and then we're going to go do pictures as well.
Awesome. Let's head down.
All right.
Okay, thank you all for indulging us, and those pictures can be sold on eBay. Actually, eBay even exists anymore? What did I just do? I just aged myself. We're going on to public comment, and I think we have something to read, and then see if we have any public comment.
All public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole and not an individual. With the exception of the public comment agenda items, comments will be heard for items labeled for possible action and should be specific to the item being considered by the board. The District Board of Health conducts the business of Northern Nevada Public Health and its citizens during its meetings. The presiding officer may order the removal of any person whose statement or other conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given prior to removal. The viewpoint of the speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of the speech. Irrelevant, unduly repetitious statements and personal attacks which antagonize or incite others are examples of speech that may be reasonably limited. For Zoom users, please log in to the Zoom meeting via the provided link and utilize the raise hand feature during any public comment period. To provide public comment via telephone only, press *9 and *6 to mute and unmute. Reasonable efforts will be made to hear all public comment during the meeting. And we do have, we do have 2 public comments. The first one I will call Scott Finley.
Sarah's,
Okay. Okay, then we will skip Scott Finley for now, and we do have Molly Rose Lewis from Senator Rosen's office.
hello again. We were hanging out this
Hello.
morning at another
Yes,
event.
hello again, Chair Dare and the board. Just wanted to say hello from Senator Jackie Rosen's office. Not there in person today, but here I am on Zoom. Congratulations to everyone for promotions and recommendations and commendations and everything. Please do continue to reach out to our office for anything we can do on the federal level to support you in terms of funding or other legislative asks. And then, of course, we're always available to help with federal agency assistance for anything, the Social Security, Medicare, IRS, anything in that realm. So please continue to reach out to our office for any assistance, and I'm always available if you have any questions. Thanks so much for having me, and have a great rest of your meeting.
Thank you.
So that is it for general public comment for right now.
Very good. Anybody else online? Going. Okay. We're moving on to 6 consent items, matters that we have A and B. Does anybody want to pull anything, talk about it, or have a motion?
I move.
I have a first. Do I have a second?
Second.
First and second. Any more discussion? Seeing none, all in favor?
Aye.
Any opposed? Seeing none, that passes unanimously. And I think you guys notice we are not pushing the button today, so you just got to do the ayes and nays. So we're moving on to 7, Regional Emergency and Medical Services Authority. And come on down, Mr. Barry.
Good afternoon, Chairman Dare, members of the board. I'm Barry Duplantis, CEO and President of REMSA Health, for the record. I understand you've all been provided with a copy of REMSA Health's June report. For June and for the complete fiscal year, we concluded our fiscal year June 30th. Our franchise met compliance in all zones. In fact, we were 90% in Zone A for the month of June, and overall, I believe it was 91% for the whole system in Zone A's, and 94% in Zones B, C, D. During the month of June, we responded to 8,286 priority 1 calls and transported 5,176 patients to area hospitals. Our average response time was 5 minutes and 53 seconds as compared to the franchise requirement of 8 minutes and 59 seconds for priority 1 calls. Our customer survey for the month of June resulted in a score of 93.23, which was up compared to the prior month. And lastly, what I'd like to point out is one thing, and this is actually maybe a positive statement for our community at large, is that over the last year, as we look at our data, our payer mix has actually included more commercial pay and a little bit less Medicaid pay in terms of just mix of the portfolio of patients that we've addressed. And so I kind of look at that and maybe as a healthy barometer of employment in our community and lots of folks being covered by commercial insurance. So which I kind of look at that. I have no idea if I'm totally right about that, but certainly we've seen that in our payer mix. And I find that to be quite healthy for the community. That's my report for today. I'm happy to take any and all questions that anyone may have.
Thank you so much. Want to open it up to our board? Anybody have any questions, thoughts? I do want to just continue to say thank you to REMSA and their families and all that they do to continue to try to bring what we call safety in those times of need. And so thank you. We look forward to all the continued efforts to just make our region better and better. Thank you.
Thank you very much.
Oh, sure.
Yes.
Before, when you had the maps up, there was quite a bit of traffic related to the CARES campus, the homeless shelter that houses, I believe, 600 beds in the community. And many of those calls being such low priority that they didn't require transport to the area hospitals. Have you seen a drop in that volume since the new Hope's Clinic opened next to the CARES campus with their walk-in opportunities?
I don't have the data to comment on that at this point, but one thing that we do see is that in the daytime hours, folks do leave the CARES campus because the weather's nice. And so they're all over the community once they rise and shine and spread. They don't stay at the CARES campus. So it makes it difficult to really answer that question. It's just that I would say that in the wintertime, when it's cold, they're more likely to be in shelter, and the calls would be to shelter. Now we're getting the calls, but they're all over the place.
Thank you. Any other questions? Thank you. We have a first. Do I have a second?
Second.
First and second. Any more discussion? Seeing none, all in favor?
Aye.
Aye.
Any opposed? Looks like it passes unanimously. Thank you so much for being here.
Thank you.
Appreciate your report. We are moving on to our Inter-Hospital Coordination Council, presentation of accomplishments by Jordan Marchi. Did I say that right? Jordan, did I say that right? How do you say your last name? Markey. I ruined it.
Okay. All right. Good afternoon, Chair Dare and members of the board. My name is Jordan Markey, and I'm a Public Health Emergency Response Coordinator. I also have the pleasure of serving as the IHCC Coordinator. Joining me today are coalition members and leadership. First, I'd like to take a moment to introduce the exceptional leadership. With me, I have Zeb Nomura, IHCC Chair, and he will provide a brief overview of the IHCC FY24 accomplishments video.
Good afternoon. Zeb Nomura, for the record. I'm the IHCC Chair. I'm honored to serve as the EMS Coordinator for Truckee Meadows Fire Protection District and as the IHCC Chair. Today we are excited to present a brief video showcasing the remarkable achievements of our coalition throughout FY24. This video will highlight numerous exercises, trainings, and strategic purchases that have significantly strengthened our capabilities and readiness. We are proud of these accomplishments and look forward to sharing them with you. Thank you for your attention, and then we have a brief video.
We're almost there. I think we had some sound with this, right?
Yeah, there's sound.
Yeah.
It's supposed to have some.
I mean, you can lip sing it, Zeb, though.
Yes, definitely.
The Inter-Hospital Coordinating Council had several successes in fiscal year 2024. Let's take a look. The IHCC collaborates and coordinates the efforts of healthcare facilities and community stakeholders to mitigate against, prepare for, and respond to hazards. The IHCC began as a partnership between the Washoe County Health District, REMSA, Renown Health, and St. Mary's Medical Center after the 1985 Galaxy plane crash. We officially became the Inter-Hospital Coordinating Council in 1994, and the coalition now includes more than 122 partners, including EMS, fire, emergency management, healthcare facilities, and public health. HCCs, or healthcare coalitions, are prominent resources in our community and include a variety of agencies, from emergency medical services and emergency management agencies to hospitals and local health departments. Now let's take a look at some accomplishments from fiscal year 2024. IHCC partners took part in a Tahoe Forest Hospital wildfire workshop where NNPH provided an overview on patient triage, transport, and tracking to ensure consistency across state lines. And we're going to be presenting on this topic at the National Healthcare Coalition Preparedness Conference with a Nevada County representative. In March 2024, IHCC partners held a mass casualty incident functional exercise, including REMSA Health, NNPH, and acute care hospitals. The objective was to exercise the MCI plan, specifically focusing on the self-transport component and surge of the emergency departments. Then in April, IHCC partners and NNPH held a chemical full-scale exercise. The goal was to have law enforcement and fire response agencies engaged in joint decision-making processes, communication drills, and resource allocation strategies to effectively contain chemical hazards, evacuate affected areas, and maintain public safety. A key component of the response included exercising decontamination procedures on scene and at acute care hospitals to swiftly and safely remove a hazardous substance from affected individuals, equipment, and infrastructure. That same month, NNPH and IHCC held an alternate care site tabletop exercise with emergency managers, licensing agencies, legal representatives, and hospital executive leadership. The purpose was to discuss lessons learned from COVID-19 and implement best practices into the alternate care site plan. The next month, IHCC held an MCI full-scale exercise. It involved the city of Sparks, hospitals, fire and EMS agencies, law enforcement, emergency management, and other healthcare facilities in the region. The exercise tested the MCI plan, specifically focusing on the self-transport component and surge of emergency departments. IHCC members and NNPH supported the Reno VA in its National Disaster Medical System exercise in June. The goal was to validate the availability of the Reno patient reception site to safely receive, assess, stage, track, and coordinate transport of patients. IHCC members were able to acquire funds through a variety of sources to support members and initiatives. IHCC spent approximately $1.6 million on supplies and equipment for the healthcare community that went to about 20 different organizations. To further support IHCC initiatives, members took part in hospital preparedness program capability assessments. The purpose was to gain a better understanding of strengths and areas for improvement by provider type in Washoe County. And these assessments have the potential to be used as a national model for assessing the HPP capabilities. And the IHCC coordinator will present on this topic at the National Healthcare Coalition Preparedness Conference this December in Florida. IHCC also completed a hazard vulnerability analysis among healthcare members. The data was compiled and weighted to identify the top 10 hazards or risks to healthcare. Some of these top hazards include earthquake, infectious disease outbreak, and cybersecurity. Looking ahead to fiscal year 2025, providers have identified their main priorities. For EMS and fire, those priorities include training and exercising on different plans, general plan updates, and interagency training with law enforcement. For clinics and ambulatory surgery centers, it's all about recruitment, emergency operations planning, surge capacity planning, as well as staff and resource sharing planning, including mental and behavioral health resources for staff. For hospitals, priorities include training and exercising, as well as business continuity recovery. For home health and hospice providers, data collection exercises were identified, as well as incorporating lessons learned from real-world examples. For public health, priorities include MAEA updates as well as cybersecurity exercises. And for skilled nursing, memory care, and assisted living, priorities include evacuation planning and training, staff and resource sharing, cybersecurity, and exercise planning. The Coalition would like to thank each and every IHCC member. Without you, we could not do this critical work. And we look forward to more successes in fiscal year 2025.
So just a couple more comments, just that Andrea and Jordan do extraordinary work behind the scenes to help support the coalition. Everything they do helps us navigate where the money goes, how to support these other facilities. Like this year, we've had more participation with SNFs, which has been something we've been lacking for the last few years. And having this participation is helping us broaden our scope of people within our coalition and get better ideas. I don't know if you guys have anything to say, but any questions for us?
I do.
Testing 1, 2, there you go.
I've
Go,
been
John.
going to these meetings, I think, for about the last 9 years. The whole group inspires me every darn time I go. And it's not, we've got great leadership, we got great people that work for us to keep this thing rolling, but it's the outside participation, and it is a large group. We take the A and B conference room and completely fill it to doing it, so we have lots of interest, but we are way ahead of many, many communities that some don't even have planning. We are now teaching the planning to them. So I'm really proud of this organization. And we're not all getting paid. It's all stand-in and volunteer. So we got great people. So thanks to IHCC.
Thank you for sharing. Any other questions? Sure.
Those are great comments. Dr. Novak, I was curious about two things. 1.6 million on equipment. Where does that funding typically come from, or the bulk of that? And the second part is, you mentioned 122 partners. Are there still folks in the region that do not have a seat at the table, and what are your efforts in trying to draw them in?
Andrea S. for the record. So that $1.6 million came from unspent funds across the entire state of Nevada that were going to be sent back to the federal government. So I petitioned the rest of the state to let us have those funds, those other local health authorities, and convince them that they should give us the opportunity to spend those funds. I do want to note that it was a team effort to acquire all the supplies and equipment. We spent about $1.6 million in 1.5 months. However, that planning took about a year and a half, and I would not be doing a service without giving credit to Kelsey Zasky back there. She got us new quotes every single month, because every single month they expired, and every single month we waited for a sub-grant. And so there was a lot of work behind the scenes. There was, from ventilators, med sleds, first responder equipment such as radiological, just PPE in general, just regular stuff. But we also got a critical care unit, neonate transport unit, sorry. And that was a credible resource. It's about $250,000 to purchase that. And the one we had two in our region. One was no longer in service or end of life, and the other one was soon to be end of life. And so it was an incredible accomplishment as our coalition petitioned the rest of the state to get those funds and bring those resources here. Your second question was about members not at the table. I think that the staff has done a tremendous job over the years trying to reach out and get staff to the table, or all partners to the table. Most of our partners, this is another hat they wear, and so it is hard for them to always meet and get to our meetings. We do try to reach out them as best as possible. COVID definitely decreased participation. However, I think that we are increasing that again, but I think right now the only agency or group not represented is probably group homes. That's very hard to get them to the table with the turnover that we see in administration.
Well, excellent job keeping those Nevada dollars here in the state.
And kind of as mentioned, I would say, Commissioner Garcia, she mentions just how many people come together. I think collaboration is the key, and that is the one thing, as John Novak mentioned, is not happening in many communities. And so I think you guys see this, part of why they have you speaking at some things coming up to show how we did what we did. So good job. Great job.
Yeah, I just want to point out the ventilators. As she talked about, we have used them on patients already, that they've been deployed in the community. So we've used those ventilators to do the monitors, CPR devices. All agencies got new mechanical CPR devices. It's stuff that goes to our patient care. It's great.
Yeah, go ahead.
Hi, for the record, I'm Brian Taylor. I'm the emergency manager for REMSA, past chair of this organization for 2 terms. And I just wanted to mention to you guys also, as Dr. Novak knows, you have a coalition here that is envied by the rest of the nation because of that collaboration that you spoke of, Chair Dare. It is an organization that breaks down any kind of political lines or ideas of, we need this and you don't need it. And there's no argument, there's no discussion in there. We just do what's right for the entire community and for us as far as healthcare professionals, as well as have reached out to the entire community to make sure that there's involvement of anybody who wants to get involved. We have the University of Nevada represented here. They are very involved in it as well. So I just want to say that it's been an honor and pleasure to serve on this for the many years that I have, actually, since the very beginning. Mr. Brown was around back then too, and he understands what things we went through and what troubles we went through back then. And we really just have created an organization that is recognized by our federal partners and by the entire coalition community. So I just want to commend these guys and let you guys know kind of what you are provided by this organization.
Thank you. Any other conversation? This is not for motion, so we want to say thank you so much. And anybody else want to say anything? Y'all good? A big high five. Thank you. Appreciate it.
Thank you.
Moving on to 9, recommendation for the appointment to the Sewage, Wastewater, and Sanitation Hearing Board. And David Kelly, come on over. Hello, sir.
Good afternoon. I'll try to make this quick. It's a pretty straightforward agenda item that you have. For the record, my name is David Kelly. I'm a supervisor with Environmental Health Services. The item before you is a staff's recommendation for the appointment to the Sewage, Wastewater, Sanitation Board. You have all the applications that we received. We promoted this on social media and also reached out to the industry as part of our teamwork. At any rate, we had one extra applicant than we needed, and we looked through those and looked at their experience with the regulations and also in the industry that we're working, as well as their history within the community, and we've provided our recommendations. I'm happy to answer any questions you guys might have, and it turns out that one of the candidates, Matt Bueller, also is here in case the board has any questions for him.
Are there any questions, thoughts? I'll thank you for the process, appreciate it, and Matt, thank you for being a part of that, and very good. So with that said, if there's no questions, I'm looking for a motion to accept.
So moved.
I have a first, do I have a second?
Second.
I'm going to give it to Garcia. She was just barely quicker than you. First and second, all in favor?
Aye.
Aye.
Very good. Passes unanimously, and thank you for serving another term, sir.
Thank you.
We're moving on to 10, recommendation to approve a letter of support for the One Water Nevada Advanced Purified Water Facility at American Flat. And I believe we have a public comment on this, I heard.
Yes, we do have 2 public comments.
2 public comments?
So
Sure.
first, I will call Scott Finley.
Please enter my comment in these documents into the record pursuant to NRS 241. My name is Scott Finley. I am a resident of Washoe County and have a military background in the United States Air Force. The Northern Nevada Public Health Board must reject the recommendation to approve a letter of support for the One Water Nevada Advanced Purified Water Facility at American Flat. None of the water produced at the Advanced Purified Water Facility should be injected into our local aquifer for storage. While underground aquifer storage has added benefits from reservoir storage in that it does not suffer from evaporation, this creates an inherent vulnerability. In November of 2023, I voiced concerns at a One Water Nevada meeting. If you look at the before and after diagrams, a new polishing step titled PFAS absorption was added. If you talk to the scientists and engineers overseeing this project, they will tell you that known hazards to human health are constantly being monitored. How do you monitor for unknown hazards to human health? You can't. PFAS used to be an unknown hazard to human health, yet now we know it is highly hazardous. What future hazards to human health will we discover? Even assuming that unknown hazards to human health are not present in the water being filtered, the active monitoring can still fail. If you again look at the before and after diagrams, the polishing facility has been removed. It can be safely assumed that the monitors actively measuring the purity of the water will be connected to the internet for remote access and monitoring, which would mean that the Advanced Purified Water Facility, the Reno-Stead Reclamation Facility, or even the polishing facility are vulnerable to being hacked by foreign adversaries. If the Reno-Stead Water Reclamation Facility were hacked and unfiltered bromide reached the Advanced Purified Water Facility, exposure to ozone would result in bromate, which is highly carcinogenic. If the polishing facility were hacked, critical monitoring for things like pharmaceuticals and PFAS could fail. What all these scenarios have in common is that when, not if, a failure occurs, then contaminants hazardous to human health will be injected into our local aquifer, effectively destroying it. The modifications in these diagrams imply that there is a mentality of making it up as you go and fake it until you make it, which is woefully unacceptable. What else I find unacceptable is that roughly over 6 months ago, it was stated that this project will cost roughly $125 million. Yet slide 10 states that it will cost over $220 million. At this rate, it will cost over $1 billion by the time this project is finished. Do not approve a letter of support for the One Water Nevada Advanced Purified Water Facility at American Flat. Thank you.
Thank you. You said we have a second one?
Our next speaker is Susan Van Ness.
Welcome. Come on down.
My name's Susan Van Ness, Washoe County resident. I too have attended the public meetings for this One Water Nevada, and this seems to be coming from the North Valleys up to the American Flats. I have contacted several people who have have done similar research in other states, but the one that I found was from Canada. And it's from the Canada Military Family Magazine. They said that water polishing is fallible. System failures, equipment malfunctions such as membrane leaks or UV lamp failures can reduce treatment effectiveness. Inadequate maintenance, this is one thing we asked about and didn't get any answers. Lack of regular maintenance and monitoring can lead to reduced performances. We asked them if they were going to have 24/7 maintenance on this before they were going to release it to the public, and there was no answers. Chemical residues, incomplete removal of chemicals and incorrect dosing can leave residues that might be harmful. Emerging contaminants, new pollutants such as pharmaceuticals and personal care products might not be fully addressed by these conventional polishing methods. So to ensure safety, there's got to be regular monitoring. Every question that we ask in these meetings, we were never given a solid answer on would there be somebody there 24/7, 7 days a week, to monitor everything in this water. Because remember, it's coming from black sewer water, being pumped down Ramsey up to the aquifer up there. Once they go through the polishing, are they going to be monitoring it 24/7 before it is distributed for drinking water into our homes? Thank you.
Thank you. Is that all the public comment?
Yes, Chair Dare. That is all.
Okay, Robert Fida, would you come on down?
Good afternoon, board members. Robert Fida, Environmental Health Director, for the record. In front of you, you have my staff report regarding the One Water Nevada Advanced Purified Water Facility at American Flats. In accordance with NRS, in order to be eligible for this project, the One Water Nevada Advanced Purified Water Facility, in order to obtain their permit from NDEP, their regulating agency, they are required to obtain a letter of support from the local health authority. So that would be the District Board of Health. And this project is for a A+ category effluent, which is a highly polished effluent designed for indirect potable reuse. Indirect potable reuse is essentially a methodology where the water is used through an environmental buffer, in this case the aquifer, and is treated within the aquifer and then drawn out for essentially water uses, so drinking water, irrigation, whatever that may be. So the One Water Nevada project is a joint effort between City of Reno and Truckee Meadow Water Authority. So this project is designed to kind of enhance our water resource portfolio and divert some of our wastewater from traditional discharge points. So the facility is located at the Reno Stead Water Reclamation Facility, and it'll be diverting discharge from Swan Lake into this facility. And so from a public health standpoint, this project does have public health benefits. It allows for clean and safe access to drinking, or clean and safe access to water. The water designed at this facility, ultimately, I believe the Truckee Meadows Water Authority is looking at direct potable reuse, but this is essentially a step towards that goal. By the public health benefits include essentially just expanding our access to clean water. We get it from different sources, the Truckee River aquifers that we have, and as well now potentially in the future direct potable reuse. Okay. And so the water that's produced by this facility, initial testing shows that it exceeds and meets all federal drinking water standards, which are even more stringent than the discharge standards that sewage treatment plants are required to meet before releasing this water to the environment. Some of the information that was provided to you shows kind of the treatment train, some of the education outreach done by One Water Nevada. And so I was going to say, so staff's recommendation is to support the project from a public health benefit. It is a boon for the community. And I will kind of open it up to any questions to the board at this point.
Sure. Any questions, comments, anything? So I'll start it. One of the things quite a few of us have got to go see these things in action. I think it's important that we are not the first. We are not just jumping out there with a parachute, hoping our parachute opens. We are watching this, and we're actually even going slow when it comes to the public process. One of the things that we must be diligent on, in my opinion, is looking to the future and leaving a legacy for our kids, grandkids, and even their kids, of making sure that if our river ever didn't do what our river's doing, that we have the potential of growing and learning more and more about this process. And so I do support this fully, and I think it's fantastic that we are looking at options. I know as we go, and I only say this because it was brought up, can you just for a moment speak to the kind of maintenance potentially that would be, I mean, I know you don't know exactly what TUMWA's going to do because you're not TUMWA, but I know as a health board, we inspect things and we expect things.
This facility would actually fall under NDEP jurisdiction. We do sanitary water surveys for groundwater sources for NDEP for essentially compliance. So there is a system already in place for these water systems. So there's actually a few checks is what you're having. You have on the wastewater side, you have discharge limits that are reported to NDEP. And then when that water is redrawn for any drinking water purposes, there is another set of checks at that point for drinking water standards. So there's a few different systems at play when this water is being reused. So as to the maintenance piece, I can't speak to that. That's going to be more of a kind of a technical point that maybe TUMWA or their representatives can answer regarding that. But yeah.
Yeah, and something that it's some of us serve on the TUMO board, so we know what we do with our water now. And I say that, I know it's a different board, but I do think we can speak to that as well. So, well, thank you very much. Any other comments, questions? With that said, I am looking for a motion.
Mr. Chair, I move to approve.
I have a first, thank you, Sir Reese. I have a second. Any more discussion? Seeing none, all in favor?
Aye.
Any opposed? That passes unanimously. Thank you very much. Thank you for the information. We're moving on to 11, review, discussion, and direction to staff regarding the provisions of the interlocal agreement entered into by the cities of Reno, Sparks, and Washoe County for the creation of the health district. This is something fun that we're all here because of this creation, and so we're glad to be here. We have many different purposes of what we do, but I'm going to hand this over to you, Ms. Reed.
Thank you. Dana Reed, Deputy District Attorney. You all may recall this is carried over from last month. The District Board of Health is requested once a year to review the interlocal agreement and determine whether or not it has any desired changes. The authorities, of course, are the three governing jurisdictions, Reno, Sparks, and Washoe, but the task of this board is to determine whether they have any recommendations that they would then advance to the jurisdictions for discussion, generally at a concurrent meeting, and perhaps further revisions or edits to the existing interlocal agreement. You might remember the last time this was done was when the Board of Health recommended the name change for the health district, and it ultimately went to the three jurisdictions at a concurrent meeting, and they approved that, and here we are today as Northern Nevada Public Health. So this is the opportunity. Any changes would have to be placed into activated essentially by October 1st of this year, 90 days before the renewal period for the agreement, which is on January 1st. So basically, it would have to be done within the next 2 months.
And I do want to point out, just for everyone to understand, because I know there was some conversation and we're continuing to dance with REMSA and what was going on, but this particular thing is about us. This is us. This is us as a board, that we exist, and we exist for the cities and county. And so any conversation or thoughts that anybody would have, it's important that you know those are different conversations, and that's a different time. So just want to make sure that's very clear. With that said, is there any conversation or questions regarding our interlocal agreement, or any suggestions? I think we should all wear John's shirt. I think that might be something we put in there. Devin, you can't see his shirt, I don't think, but it's quite bright. With that said, I don't believe I have anything to put on this particular year. And so with that said, I'd ask for a motion.
Motion to accept the ILA in its current format.
I do have a first. Do I have a second?
Second.
I have a second. I'm going to give it to, I haven't heard him speak yet, so it's so good that he's here. It's good to see you, brother. So Dr. Clacking, and then any more discussion? Seeing none, all in favor?
Aye.
Aye.
Any opposed? That passes unanimously. Thank you so much. We are moving on to our presentation and discussion on status and design of the CHIRP Tuberculosis Clinic with Ms. Erin Dixon.
Good afternoon. For the record, Erin Dixon with Northern Nevada Public Health. As you are aware, we are in the process of designing a new TB clinic, and I'm excited to share the progress and the timeline with you. To start off, here's what the building is anticipated to look like. It will be a freestanding building with state-of-the-art technology that will serve TB clients, staff, and have additional office space. It'll be approximately 7,000 square feet, and I've been told that the most important aspect I need to share with you that is on time and on budget. Yeah. So in this very brief presentation, I'm going to talk a little bit more about the services that our TB clinic staff provide, why we need the building, and the features that will be included. So there is a misconception that TB is a disease of the past. However, across the nation, TB rates are rising, and in southern Nevada and in California, there have been recent large impact exposures. When we talk about TB, there are two types, active, which is contagious, and latent, which is currently not contagious. Our clinic provides services for both, and we are required to based on NRS. Active TB requires over 6 months of consistent treatment, and there are a wide variety of symptoms you can see here. Latent also requires treatment, and that is in order to prevent its progression to active TB. These individuals will test positive for a skin test, but are currently not symptomatic. So you may have heard in the past that the clinic has 7 current active cases, or some number similar to that. That does not actively represent the work that our team does. For example, in FY 2023, there were 1,409 appointments, included screenings, medications, direct observed therapy. This is actually watching clients take their medication every day, where some of our clients require. We do contact investigations, so this is where contacts or potential new cases are investigated. We monitor side effects. The side effects of the medication can be discouraging and lead clients to want to stop the treatment prior to completion. Education in the community, and then the high priorities for staff when addressing latent are the groups listed below. In addition, testing requirements have been increased in some situations, leading to more case investigation for our team. So currently, our team is following 52 such cases. So why don't we just stay where we are? Our current clinic is located at Kerman on 10 Kerman Avenue. It's right next to the renowned main campus. The building was built in 1959 and was served as the first health department. It was last renovated in 2003. We shared the building with the medical examiner until they moved out in 2017. It is in need of extensive updating. There are ongoing facility work orders ranging from leaking roofs, bugs, odors, and the list goes on and on. But why do we stay? It's because the clinic rooms have negative air pressure, which is critical to the prevention of the spread of respiratory communicable disease. This building was the first line of defense during the pandemic and was used to test the first COVID cases. The pictures on the slide here include exam rooms, and Dr. Kingsley in the middle is in the room that serves as an office, a break room, and a meeting room, so it is well past its prime. So here's a very basic timeline. Money was secured after years of trying. I cannot do this presentation without giving a shout out to Ms. Lotritz and Mr. Dick for securing this funding in the spring of 2023. The BCC then secured the property where the building is going to be going. We anticipate breaking ground before the end of the calendar year and first client seen in early 2026. So where exactly will it be located? If you look on this map, we're sitting in the red octagon. It will be down the street on the corner of Sutro and 9th, which we kind of currently call the West Hills property. That is where it's going to be located. However, we are not going to be part of the West Hills building. If you'll see the existing property, there's a little bit larger parking lot. We are going to be that darker brown building that is not attached, but it's going to be separate from the building, from West Hills. The West Hills project did receive funding to make some enhancements, but they received their funding after we did, and therefore we are farther along in our process. They are currently working with the community to determine the exact uses of all parts of their building. However, we, along with our construction team, have transition plans so that our opening will not be impacted by the fact that we are slightly ahead of their time frame. For example, once we open, their construction access will be through the Sutro, leaving the 9th Street entrance for our staff and clients. This slide really hurts me. However, I just wanted to show you, this is the full, very basic floor plan. On the left will be facing north. That's going to be the TB side. In the center, it's going to be common areas, a very nice conference room, a break room, and then on the right is office space that will be used for, right now is identified for our chronic disease and injury prevention program. That program is the perfect size for the space that we had, and they don't see clients, so it was a good fit. You will also notice that, I hate to say this, but even if we were to have another pandemic, we would have a clinic on one side, and we could potentially do disease investigation on the other side. So it would be one building. Okay, so what you have here is a very basic floor plan for the TB clinic side. The orange is staff office space, and the yellow is the clinic space. The clinic was designed with staff and client safety at the forefront. This includes staff line of sight to parking and entrance areas, the ability to buzz in clients, medical incident call system. It has also been designed for licensure. While there is currently no state licensure requirements for the TB clinic, but that may change in the future, so we are prepared if that will happen. And negative air pressure, this is where I'm going to dork out a little bit, I apologize. But negative air pressure, we have our 3 exam rooms, 1 ante room, and 1 sputum induction room that will all have negative air pressure. Our existing building, it is required to wait 38 minutes for the air exchange between each client. This will drop it down to 23 minutes, and we will also have UV lights to assist, and that does not include the time reduction based on those UV lights. So this is really exciting for us. During the pandemic, staff were using the hallways to don and off their PPE. We will not have to do that anymore. This will be very valuable on a number of fronts. And then the sputum induction room is really to assist clients in producing an effective sputum sample. Staff will have access to the desired equipment in a location where there is no time pressure put on the client, and it will be very helpful. Everything will be ADA compliant. I know that sounds very basic, but our clinics are not right now. And staff will no longer have to share restrooms with clients. There will be separate restrooms for clients, and on the other side, in the light blue down below there, there'll be employee restrooms. So, very excited, very brief. As a reminder, this is what we anticipate the building will look like. It will unfortunately not come with the Mini. The team is also at the point where we're looking at color schemes. There's a meeting on Monday to talk about furniture and what can go in there. We're really excited about this building coming to fruition. We really appreciate your support when it comes to this. It has been a long time coming, and our staff really deserve it in addition to our clients. So I'm happy to answer any questions.
Thank you for the update. Any questions or thoughts? I noticed Nevada blue. That probably should stay. You know, I'm just saying. I wouldn't go red.
There will not be red.
Any thoughts?
Yeah.
Sure.
How many patients do you expect to be seeing there, people coming in?
So our current, we have the ability to significantly increase the number of clients that we see. We hope we are not in a situation where we have to see more than we're at. And we expect to be able to maintain the clients. If the clients that we currently see, I haven't done the calculation of how many we could see. If we turn the sputum room into an exam room, if we are able to turn the ante room into exam room, that would give us 5 rooms that we could turn over every 23 minutes to see clients.
If you have a client.
Can you talk to the microphone for
It's on there. A TB case, how long does that take? How many times are they coming in, or how long does that take to treat?
Well, the full medical treatment, it takes between a minimum of 6 months, depending on the client, depends on how many appointments they come in, whether it's med refills, whether it's for labs. I would hate to give an exact answer. Yeah. But I might make Lisa.
So they would be treated at this spot for the 6 months?
Mm-hmm.
Lisa Lottridge, Division Director for CCHS for the record. So yes, it ranges as far as the amount of time for treatment. We've just had one that it's 9 months. So it just, depending on their particular situation. I'm sorry, the rest of your question was?
I think that was it, just how long they're treated for, because I think the amount of new cases in the United States is about 3 for every 100,000 in population.
Right.
So if you looked at us at a 600,000 population, that would mean there'd be 18 new cases a year about.
And
so I was
with-
just thinking
yeah.
about the investment in this and trying to look at that.
Right, and with each of the cases, some of them, once they've come in for a med refill or they have their medications, based on their situation, we may go to them. So they're not actually in the clinic. It depends on the client and the particular situation. So yes, Med Starts would be there when, on Thursdays, we have our doctor on site and he meets with some clients. So it just depends on the situation, but this will definitely give us more capacity.
Do you currently go out to prisons where this can really take off and we see a lot of trouble with TB?
We do not go into the prisons, no, but we do provide technical assistance if they need it, but they would be treating their own clients.
They would treat them there?
Yeah,
Oh.
right.
Thank you.
Thank you, and I do want to say to the public, if whoever's listening, and to us, reminder, is we're doing a good job when we actually don't have, that's public health, I've learned that more and more. The less we have, the more education we can do, and the more prevention we can do. That's us doing our job at best. Because some people might say, $10 million for this building and what we're doing. I promise you that we don't have a building like this. The cost and the problems come far, far more. So great job on getting the funding. That's fantastic. We appreciate the update. And if anybody else, sure, Ms. Garcia.
Thank you, Mr. Chairman. I didn't realize it was linked to Nevada state statute that we had to provide this service as a health district, and maybe I'm not alone in that. Many members of the public probably are in the same category I am. That said, how many of these clinics exist currently in Nevada? How many of the health districts have their own? Are we the newest shiny object in the state? Are we serving individuals from outside of Washoe County?
As far as the number of these clinics in Nevada, I can't speak to that, but the hospitals do have negative pressure rooms, and Dr. Danko can speak to that. They do, when they have clients come in that require, they can put them in those rooms. That is the big thing for us, is that we have the capacity to have these clients in a safe environment where once they're in there, I mean, the visit can be a couple of hours. We don't want them to have to keep that mask on the entire time. So we have them have their mask on. Once they get in the room, they can take that off, be comfortable. They're not feeling well anyways, and we can keep our mask on. So it's more having that safe environment to do our job. But I know Renown has them. I'm certain St. Mary's has them, and Northern Nevada has the negative pressure rooms, which is the big part.
Very good. Well, thank you for the update. Appreciate it. Okay, we are moving on to staff reports, and Francisco Vega, Air Quality Management. What do you have today for us, sir? Cool.
Thank you, Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. Just really quickly, I did provide in my report some information on a recent Supreme Court case that may impact how air quality and the Clean Air Act is kind of implemented, so just wanted to highlight that. I also did want to highlight that in June, we did have 2 exceedances of ozone. They did occur during the nighttime, which typically we expect to see ozone exceedances happen during the day when it's hot, but these occurred overnight. So our analysis kind of determined that the ozone pollution was transported here. So they are exceptional events. But I did want to highlight that, again, we did experience 2 ozone exceedances in the month of June. That's all I have for my update, and happy to answer any questions.
Any questions? I just want to know with the heat index, how are we doing? I mean, in the past, we've seen this heat index happen, and that's sometimes our air quality breaks. You know, that's where we get in a lot of trouble. Do we have any idea how we're doing, or we have to wait for a month to see how we're doing?
Yeah, it's hard to say at this point in time. We have obviously seen elevated temperatures. Typically that results in higher ozone. But we've been kind of carrying on in the kind of the middle, moderate zone for ozone typically, which is kind of good news. We have had some impacts from some wildfires, but for the most part, we've kind of steered clear from that as well. So all in all, again, we're doing pretty good from an air quality perspective. Just these kind of unusual overnight events that, again, we expect happen from transport. But again, the elevated temperatures to this point have for the most part, kept us in the moderate zone.
Thank you.
Yep.
Appreciate it. Okay.
Thank you.
Thank you. Community and Clinical Health Services, and that's Ms. Lisa Lutritz. Come on down.
Lisa Lotritz, Division Director for CCHS. You have my report in front of you, at which we featured our customer satisfaction survey. We do that every February, and so just wanted to share that with you. As usual, our staff is doing an amazing job and have pretty high marks there, and I did discuss some of the things that we're working on just to continue to improve that. Some additional updates, I wanted to just keep it in the forefront of our mind, our CCHS assessment, just some of the things in the last month that we've been working on. We started intermittent hourly evaluations on July 1st. So that, where that never took place before, now each of our intermittent hourlies will be getting an evaluation and more of a way to check in with their supervisor and see how things are going. So we're excited about that. And then the utilization of our electronic health record was also a recommendation. And we have seen during just back to school so far, utilizing the data that we receive to guide us. We've been really taking the time to monitor the schedules and increase our staffing based on what it shows. Like Mondays have been really high, so we're adding another nurse on. Actually, we've been adding a nurse every day. So that I think that has been helpful. So we'll continue to work on the assessment. Wanted to just remind everyone that the Bridge program will be coming to an end at the end of August. And this is going to, I believe it's going to be pretty impactful for our community. This is how individuals with no insurance were able to get the COVID vaccine last season after it was commercialized. And so that will not be an option this year. We are exploring and working with our community to figure out a way how we can provide the vaccine to people that do not have insurance. Just to give you some numbers, last year 14.6 million people used the Bridge program across the nation. And so we gave, just at the health district, over 500 doses through the Bridge program. And with each dose about $128, it's pretty significant. So I will keep you posted on that, but we're working with community partners to see how we can ensure that our uninsured clients have the ability to get the vaccine. We are getting ready for back to school. We have the Family Health Festival on August 8th, and we have 2 Saturday back to school events on August 10th. Which we are working with Community Health Alliance, and really will be using the entire campus here, so it's going to be quite busy. And I just want to give a shout out to our communications team. I don't know if you guys have seen some of their social media posts. Really cute, and we have a press release going out on Monday. So, yeah. And I'm happy to answer any questions.
Any questions? My only encouragement, and I do understand we want to help as many as we can here, but that's part of what we do is if it's available other places, that's part of why we might be where we're at. It might be really good to have those community partners to just make sure we have really good communication and really warm handoffs, I would say. Something to think about. Just when you were talking, it made me think of that.
We're definitely working together. I think the big thing is where the pharmacies also had Bridge last year, where you could go to any pharmacy and get it if you didn't have insurance. It won't be that way this year. There's going to be a lot less options for people. So we'll definitely get the information out where they can go and work with our community partners to make sure, just work together and make sure there's opportunities for people.
Thank you. Yeah. Appreciate your update.
Thank you.
Okay, we're moving on to Environmental Health Services, Robert Fida.
Good afternoon, board members. Robert Fida for the record. So in front of you, I have my report. I want to highlight a few things, and I also do have some challenges that I kind of wanted the board to be aware of as well. So to start off on some positive notes, it's temp food season right now, and a lot of work is being done. This coming Monday, we have our permitting fair, so we have state, local, and community partners reaching out to our mobile vendors to essentially help get them the resources they need to be permitted. This is in relation to the street vendor bill. We're doing outreach to our community to help them kind of get permitted so that they can serve food safely. And then additionally, we also rolled out our new annual itinerant permit. The first year, we're projecting to allow operators who are willing to participate in 8 or more events to obtain this permit. That'll be essentially our trial run, and we'll reevaluate next year, see what we can do to improve the program. And then some of the challenges with temp event season, it's, as you may have noticed, there's a lot more events going out and out. So our staff have been running into some issues in the field. Some of them was, there was a few mobiles that did not have any water while they were servicing food. We had some issues of temperatures being out of control, especially since it's hot outside. It's very difficult to sometimes maintain those temperatures. And then staff have also been running into issues with some of our larger events submitting kind of a little on the late side. Recently, we had a large event submit maybe less than a week's notice. So staff were able to scramble and kind of give them a review, get them kind of out the door, but we ended up being understaffed, mile-long venue. We only had 1 staff member scheduled. Luckily, some of our seniors stepped up and was able to assist that staff member out in the field. And so I asked that if the board ever hears of any large events to kind of encourage them to engage the health district early. We prefer these events to come in at least a month early. That way we can prepare and make sure that there's proper infrastructure, number of restrooms, trash is managed accordingly, same with wastewater. The event, because it was so last minute, we saw issues across the board in waste management, in essentially access to restrooms and so on and so forth. So, but we also did release our June food safety letter, and we highlighted a few of our Excellence in Food Safety Awards. This month's recipients were the Rayleigh's Deli on Coughlin Parkway and Peg's Glorified Egg and Ham on Lemon Drive. So, and additionally, I wanted to highlight some of staff's great work. So since the start of pool season, our staff have inspected 87% of all seasonal pools now. So they've received an opening. At this point, staff are trying to locate and coordinate openings with those outstanding pools that haven't contacted us for an opening yet, or to at least verify their closure. And then in our safe drinking water program, as you may know, the lead service line inventory rule is coming out. So a lot of these smaller water systems are required to submit an inventory of their existing service lines, which are lead and which are not. We had about 80% response from our regulated public water systems, and they are anticipating that they will complete the lead service line inventory by the October deadline. So it's good news. Other than that, I will open it up to the board for any questions about my report. So.
Any questions? And I would just encourage all of us, especially, oh, go ahead.
Kind of a simple question. When we went down the end of June to do the food truck Friday food trucks, you've got 6 mobile units while, no water, hand washing problem, 12 violations of food. Is that about a normal violation level? Because there is a lot of trucks and a lot of people.
There is. I'd have to look at the historical data. I can't speak to that. I know staff highlighted that for me, that they've been seeing a few issues in the field. So I don't know if it's a spike or if it's a trend. So
okay, just curious.
I think we also do seem to have more trucks and things in the area than I've ever seen.
Oh, yes. It's greatly improved since COVID.
Yeah. So the one thing I would say, a lot of us are connected to some of these larger events, and I appreciate what you just said. I think we can help by just communicating to them what is proper expectation. So not that you don't tell them, but we can help reinforce that.
I appreciate any help the board can provide. So.
Okay. Very good, thank you.
Thank you.
Okay, Ms. Nancy Dow, we have our epidemiology and public health preparedness.
Good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. So you have my report. I have nothing to change or add. A few highlights for EPI. We had multiple publications in EPI News in the month of July, one of which is our quarterly communicable disease reporting and statistics for quarter 2 of 2024. The issue just covers tables and figures for comparing reported morbidity of selected communicable diseases during the most current quarter in comparison to historical reported over the previous 5 years, and that report is up on our website for a glance of how we're doing instead of waiting for our annual report that comes out. We've been seeing some increases in COVID cases reported week over week since the beginning of June, but more noticeably since July 4th for new cases by onset date. We are currently averaging about 30 cases per day in the last 7 days, looking more similar to numbers in February of 2024. Deaths reported continue to be at a pretty minimum right now. Our epidemiology COVID contract unit staff are transitioning off by the end of July, so July 31st. So program epidemiologists and statisticians are working diligently on transitioning of duties to take on additional tasks. I do want to express that this was and is a tremendous group of individuals who has really helped us through some of our most difficult times. So much thanks for their work. Also, our final day of offering home testing ended on July 19th as due to both demand and the changes for upcoming capacity. That's all my updates. I'm happy to answer any questions.
Any questions or concerns? Thank you so much, good job.
Thank you.
And going to you, young lady.
All right, I'm going to give you just a brief update, but then I'm going to ask our government liaison to come down and provide the legislative update when I'm done. As I know that was requested last time. So it's just...
I'm sorry, it's not agendized. Usually we agendize the legislative update and the speakers separately, so I do have concerns about that not being on the agenda.
So can I just then give the update that's in here?
I would recommend
I can do that.
we not create a separate agenda item with a separate
Oh,
speaker.
sorry, I was just going to have her give the update, but I will give it instead. Okay,
Thanks.
I can do that. Thank you for that, absolutely. A few just quick highlights. Accreditation, we're in the final stretch, and staff are now looking at just making sure the documents are all formatted properly, and then before that's submitted, so that's really exciting. We had a wonderful quality improvement training, and that was probably one of the best trainings I've been to in a long time. Really going to set the foundation for as we move forward with some of our quality improvement projects. We have a family health festival coming forward on Saturday, August 3rd at Hug High School from 9 to noon, if anyone is interested in joining. I also need to do a really big shout out to the team that was invited to provide a poster board presentation at the NACCHO 360 Annual Conference on our efforts to advance the organization's mission through partnerships. So it's very exciting, and the team is doing that right now. And on to the legislative update. So the team's been incredibly busy strategizing with key partners for the upcoming 2025 legislative session. It'll be the first Tuesday in February, and that is going to come up very fast for all of us. We have been working with public health partners on the sustainable funding stream so that money would be allocated non-categorically. This is something that we've all decided that we need. And the key factors that were missing in last session, SB 118, are being addressed, including a base funding formula that will also provide funding for smaller counties that will have enough money to work one county received $6,000 with SB 118. That's really hard to implement a program that way. So we're looking at $200,000 per year per county, and also including the tribals communities in that funding would be very exciting. Our key partners include Nevada Association of Counties, the Department of Public and Behavioral Health, UNR School of Public Health, Southern Nevada Health District, Carson City Health and Human Services, and Central Nevada Health District. We're also looking at the restoration of vaping prevention, and more reports will be available in the fall, and we will agendize them separately. Absolutely.
Anybody have any questions for our standing in District Health Officer, Aaron Dixon? Any questions? Okay, very good. Thank you so much, and thank you for the updates, and please continue to do that. Maybe next time we do get a separate agenda on that we can ask some questions as well. So, okay, with that said, we are going to board comments. Any board comments? Going, and that is gone. Meeting adjourned.